Hi everyone, welcome to today's wellness session. This month our focus has been on mental health as May is Mental Health Awareness Month. Today we're going to wrap up this series and we're going to be talking about the different kinds of treatment for mental health. The good news is there is hope and recovery is real. The first form of treatment we're going to talk about today is psychotherapy. Psychotherapy is a therapeutic treatment for mental illness that is provided by a mental health professional. Psychotherapy explores thoughts, feelings, and behaviors and seeks to improve an individual's overall well-being. Different types of psychotherapy include cognitive behavioral therapy, exposure therapy, dialectical behavior therapy, and many more. In most cases, psychotherapy paired with medication is the most effective form of treatment to promote recovery. Medication is another treatment option for mental illness. Medication does not outright cure mental illness. However, it can provide some symptom management and relief for individuals that are experiencing issues with mental illness. Some types of medications that may be prescribed for individuals experiencing mental illness include anti-anxiety medications, antidepressants, mood stabilizers, stimulants, and antipsychotic medications. The next treatment option for an individual experiencing issues with mental illness is case management. A case management involves a case manager assigned to an individual with a mental illness, and this case manager coordinates services for the individual. The case manager may assess, plan, and implement different strategies to help the individual be successful and reach their goals. Another treatment option for an individual with mental illness is hospitalization or crisis stabilization. In this situation, the individual is posing immediate risk of harm to themselves and others and may require the need to be closely monitored by a physician or some other kind of mental health professional or medical professional. This treatment option is typically temporary until the individual is more stable. And once they're discharged from the hospital, the individual usually receives some kind of outpatient treatment, which may include some of the other options that we talked about in today's session. Another form of treatment is a support group. So this involves individual members that are typically non-professionals that guide each other and lean on each other to help support each other through whatever it is that they're experiencing difficulty with. This could be in the form of grief support, or if the members have lost somebody to suicide, or maybe some other kind of specific symptom management or mental health diagnosis or disorder. Another option for treatment is called a self-help plan, and this is something that an individual can do with a professional or even come up with on their own to address their needs based on their issues or concerns surrounding their mental illness, and their plan would be unique to whatever their needs are and may include things like compliance with medication, regular exercise, a specific nutrition plan, maybe specific routines or schedules, or social interactions or outings. And the last treatment option that I'm going to share today is peer support. So this is when an individual receives support from a peer or somebody who has suffered similar experiences or had issues with the same mental illnesses and has progressed in their recovery, and shares their stories and their experiences and their strategies to help other individuals. The options provided in today's session are examples of the different layers of treatment that can be provided to an individual struggling with mental illness. For more information on how to access these different types of treatment options or find out what's available near you, you can contact the Georgia Crisis and Access Line anytime. They're open 24/7. The number is 1-800-715-4225, and that's the Georgia Crisis and Access Line. And locally, we have our partners with Aspire Behavioral Health. Their agency offers all of these treatment options as we discussed in today's session and many more. So I encourage you to reach out to them to see if they have any services that are appropriate for you or that can help support you in your recovery. Thank you for joining today's session, and I hope you'll stay tuned for our upcoming sessions.